There are several approaches to trying to help people with PTSD symptoms. Let's start with talking about strategies that usually don't work. So the first one is avoidance. The good news, bad news about avoidance is that it works pretty well if you don't plan on doing anything. Staying in your house, ending your personal relationships, quitting your job. All of these things can decrease the load on a person. It can decrease their trigger reactions that they're trying to dodge. Of course, you can see the obvious problems with this strategy. The person suffering from PTSD is disengaged from life. And the idea of helping them re-engage with someone to improve their situation can provoke a lot of anxiety to the point that they may just dismiss it completely. Now, they may not tell you that that's the reason they're not interested in trying treatment for PTSD. They might blame other things. So they might blame the distance to the clinic or the time required or other barriers. And it's important to kind of think of those as barriers that could have solutions. Self-medication. Now, I don't particularly like this term because the things that people put in their bodies that they call medication is hardly medicine. So the good news, bad news here is drinking or using drugs to numb someone's mental pain that comes with PTSD works temporarily, but it comes at a price. The price would be social, legal, medical, or mental costs. Not to mention, these so-called solutions are a temporary fix. They work for minutes or hours, and they're not permanent solutions for a person who has been suffering with a problem sometimes for years. The foundation of PTSD treatment, the thing that seems to work better than anything else, is effective counseling. There are also medications that can help. There are several different classes of medications that are used by doctors who prescribe treatments for mental disorders. One of the classes is commonly called antidepressants. But those medications have also been shown to be helpful in PTSD, and they form the first line of treatments for PTSD when we're going to use medications. A common subclass of antidepressant medication are the Selective Serotonin Reuptake inhibitors. I know that's a mouthful. They're often abbreviated SSRIs. And there are other classes of medications commonly used in PTSD, for example, mood stabilizers. It's important to understand that medications might be helpful, but many of them have to be taken every day for several weeks for the medicines to develop their full effect. The other thing to think about is that right now, the medications we have for PTSD only treat the symptoms. They don't reverse the underlying disorder. So kind of like pain medications for chronic pain, the symptoms of PTSD can come back once the medications are stopped. Now, there's another class of medications that some people take for anxiety. They're called Benzodiazepines or benzos. And common brand names for benzodiazepines include Xanax, Klonopin, Valium, Ativan. Now, these medications can work quickly, but they are not a good long-term solution for PTSD. Why? The risk of long-term benzo use in PTSD is that folks will require higher and higher and higher doses because they seem to lose effect in people with PTSD, and the other risk is addiction. Right now, the gold standard for the treatment of PTSD is effective psychotherapy or good counseling. There are many, many different kinds of counseling and psychotherapy available. So it's important to understand that they're really like tools in a toolbox. You want the right tool for the right problem. There's a few forms of psychotherapy that have been tested as specific treatments for PTSD. And you know what? They work about twice as well as medications do for the same symptoms. The nice thing about psychotherapy is that once the treatment is over, the effects seem to persist. The bad news about psychotherapy is that it is time-consuming and it requires counselors with very specific training in the treatment of PTSD with specific forms of psychotherapy. The two specific forms of psychotherapy that have been proven effective in PTSD are called cognitive processing therapy and prolonged exposure therapy. They're often abbreviated as CPT or PE. And it's important for folks who are just starting out with one of these therapies to stick with them. The therapies are designed to challenge beliefs, some of which the person with PTSD may have held for years. Some of their behaviors, like the avoidance behaviors, they may have been doing for years. And the point of these therapies is for the person to develop a new way of living beyond their traumas. Now, sometimes people think, is this going to cure me? And one way to think about all of this is like the volume dial on a stereo. If it's turned up to 11 and you can't hear anything else, it's noise. But with effective psychotherapy, we're hoping we're going to get to a 0. But a lot of times we can get it down to a 3 or a 4. So that allows the person to live an effective life. Something else I'd like to mention is the power of group therapy, which can be combined with the principles of CPT or PE. For some individuals who've experienced certain kinds of traumas, so for example, combat trauma or sexual trauma, there's something very powerful about being in a group with people who've been through something similar to what that person has been through. Group members can encourage each other to participate in their own counseling in a way that sometimes even the counselor can't reach. Now, people who work in healthcare wish that every patient that they saw would get 100% better with every treatment they were given for every condition. Now, we all know that's not the case. Some people respond quickly to minimal treatment, and others don't budge, even with very intense treatment. There are a few other factors that impact treatment outcomes. 1, co-occurring mental disorders. If a person has more going on than PTSD, it can cloud the picture and make it harder to take care of the whole person. For example, half the people with PTSD also have clinical depression. If you don't take care of both, then the person isn't going to see the full benefit of treatment. The next one, co-occurring substance use. This one should be self-explanatory. If the person is still drinking in large quantities, the chance of them responding to other opportunities for treatment is going to be limited. The next one, co-occurring medical disorders. So chronic pain, traumatic brain injury, other things can impact the person's ability to engage in psychotherapy for PTSD. Poor adherence to treatment. Now, this is just a fancy way of saying that the pills aren't going to work if you leave them on the bathroom counter, or worse, if you chuck them in the garbage. It also applies to counseling. If the person is scheduled for counseling sessions and they don't go, or if they go and then refuse to apply these principles in their daily lives, it's not going to be as effective. Social factors. There's pretty good evidence that people's symptoms of mental and physical disorders don't change when they're undergoing legal proceedings, and I would count the service connection or other disability claims process in that category. It's hard for someone to concentrate on feeling better if they're worried about the outcome of their claims process. Other social factors could include tense relationships at home or unsafe or unstable housing.